Welcome to Take 5 with MPOWERHealth. I'm Camille Hepola. I'll be your host today. We're with Heather Richards. She's the Senior Vice President of Value-Based Initiatives at MPOWERHealth. Thanks so much for joining us today, Heather.
Thank you, Camille.
Why are physicians nationwide engaging in clinical integration?
By becoming part of a clinically integrated network, the independent physician who could most likely not be able to afford that infrastructure is now part of an ecosystem of data and informatics that allows them to have and be on an equal playing field as those large health systems. It allows that physician to have the insights that they need to control that patient outcome. It gives them the insights and the infrastructure so that they can provide best quality and capture that in a way that we can take that information, package that, and have a dialogue with payers and employers who are most interested in aligning with quality networks of providers that specialize in taking care of their patients, improving the quality and ensuring the outcomes of those patients while delivering that in a cost-effective manner that doesn't compromise the care of their patients.
Does joining a clinically integrated network mean more work for a physician or a loss of control around decisions?
Absolutely not. If anything, it gives the physicians more control. Through the data analytics and healthcare informatics, it provides the physician much needed information that they can have better control over that patient. Through the technology that's afforded them, they can also have more control over the navigation of that patient care.
How do clinically integrated networks generate cost savings for the physician's practice?
Cost savings are realized through economies of scale and efficiencies. When we utilize technology through clinically integrated networks, we're able to take some of that burden off of the human aspect and the human resource so that they can focus more on patient care. By lowering that cost of administrative burden, that it's either savings for the practice or creating more capacity for that practice to see more patients within their normal schedules. Another efficiency is to make sure that they are leveraging centralized services so that when there are peaks and valleys in their practice, they're not carrying that overhead and that burden when they don't need it. And when they do need to maybe ramp up during busier times, they have access to those resources and are able to be more nimble and agile in how they adapt to their business needs. MPOWERHealth's role is to support the physicians within that network. MPOWERHealth looks to stand beside the physicians and to actually surround the physicians with solutions and expertise that help them to optimize their performance, their quality, and their practice. We see MPOWERHealth as being the strategic partner that we can create the infrastructure, provide the expertise and the solutions that are comparable to what the health systems have today. This allows our physicians to be on par and compete in value-based healthcare, where they otherwise will be left on an island and not be afforded the same advantages that health systems and payers realize today.
What services does MPOWERHealth offer its physician members?
Practice optimization is a comprehensive review of a practice from clinical throughput to business and administrative processes. And lots of times there's improvements that are hidden or symptomatic of other processes within the practice. So practice optimization is at the forefront of what MPOWERHealth can provide to independent physician practices. And from that analysis, we can offer solutions to help them achieve their best results. What differentiates us is one size doesn't fit all. And so through practice optimization, we will come in and we'll evaluate where those needs really are. So when you've seen one physician practice, you've seen one physician practice, and no two will look alike. And we want to make sure that when we offer solutions, they're the right solution tailored to meet the needs of that practice.
Thanks so much for joining us today, Heather.
Thank you, Camille.
Thank you again for joining us. For more information on what you heard today, head to our website.